We're back with our Thursday program, and of course our program each Thursday brought to us by Kaiser Permanente, and we're enjoying each week getting to meet one of the fine doctors who serve the patients who are part of the Kaiser Permanente family of good health care. Joining us today, a doctor who will be talking with us about the subject of cardiology. Dr. Timothy McAveney is with us today. Doctor, welcome to the program.
Thank you very much. Glad
a little bit about your background, how you got into medicine and where you studied.
I grew up in Maryland, and after college went to medical school at University of Maryland in Baltimore. Came out to UCLA to do my internal medicine training, and then did a cardiology fellowship back in Baltimore, University of Maryland. And when I was at UCLA, I met my wife, and we decided to move back to Southern California.
Great. We hook you guys one way or the other. We get you out here,
exactly,
especially when it's cold back in Maryland.
That did it. couple of cold, rainy days, and I was right back out.
Right back here in California. Well, we're glad to have you with us here. You work out at the Lakeview Medical Office.
That's correct.
Right here locally, but you also spent some time up at the facility there in Irvine, the new hospital there as well.
That's right, and I've been here for 4 years.
Mm-hmm. You know, we watch these shows on television, and these people come in from the emergency room, and they have all these esoteric diseases and things, and they have all these names for what most of us would just refer to as a heart condition. How do you define that? What is heart disease?
Heart disease is a broad term. You hit it on the head. There's lots of big names for diseases, and I think it's easy to try and categorize them to understand them better. You know, a big subgroup of heart disease is what we call cardiovascular disease. That includes the kind of diseases we're familiar with of heart attack and stroke, right, and other vascular diseases. There's heart failure, valvular heart disease, and cardiac arrhythmias, when the heart is going too fast, too slow, or maybe irregularly. I think it's, you know, there are other smaller subgroups, but I think it's easier to digest the breadth of the field, looking at those four major subgroups.
Right. You know, we often hear that heart disease is one of the major killers, and then we hear cancer, and depends on what study, I guess, you read. How common is heart disease? Oh,
it's very common, and you know, I think it is both cancer and heart disease are very prevalent diseases, very morbid diseases, and you know, one of the developments in the last couple of decades is improvement in the way we manage and prevent heart disease, which, even though it's not a runaway first place for chronic disease, it is still the most common, most prevalent chronic and potentially life-threatening disease out there. It's responsible for 1/3 of all deaths in people over the age of 35.
Men and women.
Men and women. And even, you know, the majority of people over the age of 60 have some form of heart disease, cardiovascular disease. So it's out there.
Right. You know, we hear that there's factors like high blood pressure, cholesterol, weight, some of these inactivity are some of the things that can lead to heart disease. But then we see people like Jim Fixx, who was an avid runner and advocated running and marathons and all that, and died of cardiovascular conditions. So it can catch almost anybody, I guess.
Yeah, it can, and I think one of the challenges in heart disease is that it tends to be an abrupt onset. You know, some patients it gradually develops, but the stuff that makes the news are the abrupt onsets, and the people that you would never expect, young athletes, for example. Right. They tend to be rarer, and I think we have to remember that a lot of heart disease is preventable. You know, the number of cases like the one you specified are very low. There is a limit to our detection capabilities, but I do think there's a lot that we can do to proactively prevent the disease. So you know, there are you've listed some of the risk factors. There are a number of risk factors that we can't control. Stuff like genetics, stuff
heredity.
like age,
pick your parents carefully,
stuff like gender, exactly. But I think you sort of touched a little bit on it. There are a whole host of preventable causes of heart disease. The inactivity or sedentary lifestyle, obesity, which is becoming an epidemic in our country, cigarette smoking. Your risk of having a heart attack is 5 times higher if you're a smoker.
We think of that more as a lung cancer type of thing.
Yeah, but it's probably a bigger killer for heart disease. There are lots of reasons to quit smoking.
Yeah.
But prevention of heart disease is probably the biggest. I'm biased, but
well, obviously, yeah. If you were a pulmonary specialist, you might have another take on that.
Maybe true, but you know the risk factors include the kind of things that regular checkups with your physician can help treat. That's the blood pressure, the diabetes, checking your sugars, and checking your cholesterol. Those are the kinds of things that only regular follow-up with a physician or some kind of healthcare provider will give you.
You mentioned diabetes. A lot of people think that's not related, but that can be a definite condition that can affect the heart as well.
Absolutely. In fact, diabetes is often considered a cardiac disease equivalent. It is even a higher risk for heart disease than the high blood pressure, the smoking, the cholesterol.
Interesting.
So, very important contributor to heart disease. And one of the things we've realized in the last decade is there's a lot of overlap and a lot of shared sort of pathophysiologic properties of diabetes with high blood pressure, obesity, cholesterol dysfunction.
Many people can have all 3 or 4 of those at once.
Absolutely. It's called the metabolic syndrome. It's a catch-all term to say you've got all the risk factors, and it's a subgroup that is at the highest risk for heart disease.
Bad diet, lack of exercise, sedentary lifestyle, and heredity to some cases as well.
Absolutely. I think they all contribute together.
We seem to think that you know, today medicine is a lot better than it was 10, 20, even 4 or 5 years ago. But one of the things we find that family and friends who are heart patients seem to be taking a lot of medications. You know, some things we can control, lifestyle changes perhaps.
Yeah.
Some things need a little bit of help.
I agree, and I think the best thing is to prevent it from ever becoming a problem.
Right.
And so if you can keep yourself in good physical condition and keep the weight down, avoid the cigarette smoking, you've taken a big step in preventing it. Some of the genetic factors we can't overcome initially, but I think the treatments are effective and exciting. I tell my patients, I said the good news is there are a lot of medications to help minimize your risk with heart disease. So that's also the bad news, because you end up on a lot of these medications. And once heart disease has onset, usually an abrupt onset with a heart attack or sudden symptoms, the number of medications that have been shown to be helpful does increase. And you go from taking one blood pressure and one cholesterol pill to taking medications that help prevent further heart attacks or keep you from having heart failure. So the number of medications does increase, but I think we touched a little bit in the beginning of the show. One of the reasons cardiovascular disease is not the runaway leader in mortality for this country is because we've developed treatments that help minimize that risk.
Right. We hear about the baby aspirin, and that's one thing that I know a lot of doctors recommend that almost all adults take, I guess. Yeah,
most men over the age of 50 are recommended to take a baby aspirin. Postmenopausal women should be taking a baby aspirin. Unless there are different circumstances that require different medications or doses, that would be governed by their physician.
You're more in the diagnostic aspect, but also Kaiser provides great doctors who can do things like angioplasties and up through maybe even heart transplants if required. Valve work and veins and all those things.
Absolutely. Our role is several-fold, and we do a lot of education. We do a lot of diagnostic roles and confirming diagnoses. Guiding medical treatment, but then we also have an interventional aspect. We're able to do angioplasties and, when necessary, cardiac surgery.
Does everybody need a cardiologist?
Good question. I think with the scope of heart disease, it's tempting to say, gosh, everyone should see a cardiologist. If you've had a heart attack, if you've had bypass surgery, if you've had a pacemaker placed, if you've had an arrhythmia, any of the conditions we kind of talked about at the top of the show, I think you should be following with a cardiologist. When you have the risk factors for heart disease, that can often be managed by your primary care physician, and we always tell our patients and our primary care doctors, if you're ever uncomfortable with where you are with your treatment, you have questions, feel free to ask us for help. We're here to help.
Right. Good role that you play in the whole team approach there at Kaiser. Doctor, thank you for joining us.
Thanks so much.
Good to have you on the program today. Just one of the fine doctors that serves you with Kaiser Permanente. And again, if you want to find out more about the services they provide, the number there on your screen, 932-2052. Give you more information about getting involved with Kaiser and all the great doctors like the one we've had on the program today. We'll continue on with more local happenings and more things in around our community right after this.